My name's Marianna, I'm 35, and I'm an occupational therapist. My symptoms first started in middle school with a lot of anxiety. The depression didn't come until later, but when it did, it hit hard. I was having trouble at work, I was having trouble in my personal relationships, and my depression just got really bad and knew that I needed some help. I did 2 different treatment programs before coming to Skyland. One of them was in the Atlanta area. I feel that I didn't have the community or the structure that Skyland had, and the other one just was not a good fit, and it was down in Florida. Some memorable things about Skyland were my primary counselor, Gina, and my psychiatrist, Dr. Rout, and all of the other clients that I met while I was there. There's such a sense of community, and I always had someone to talk to, always had someone to sit with at lunch. The hardest part about treatment was the first day. Showing up and learning about all of the classes. It was a little bit overwhelming, but it went away quickly. I think it was mostly nerves, but just taking that first step. I would describe my life before treatment as miserable, and after treatment, I would say enjoyable. Based on the amount of medications that I had taken in the past when I was going over my medical history with Dr. Rout, he suggested TMS, and it was based on the fact that he thought I had treatment-resistant depression. Treatment-resistant depression is when you just don't respond to antidepressants or other medications for whatever reason. And that is where TMS can come into play as an alternate form of therapy. At first, when I heard about transcranial magnetic stimulation, I was terrified. Magnets on your brain seems sci-fi. It was only until I talked to Dr. Hunter about TMS and saw the room that it would happen in and the chair and kind of went over the process is when I felt at ease about it. You'll wear a little hat that looks like a synchronized swimming cap. They'll do some measurements to find out where to place the magnets. It doesn't hurt. It's an interesting feeling at first. It caused me no pain, no side effects, and I was able to go about my day immediately afterwards. I started feeling a little bit better about a month into TMS, which is about halfway. It's been 6 months since I ended TMS, and I think the highest I would say my depression has been would be about a 1, maybe a 2. And day to day, I would say 0 to 1. So TMS, the effects really work. Currently, I work as a home health pediatric occupational therapist and go to children's homes and work with them there. And I'm able to make a difference in their day-to-day lives every week. I'm able to be fully present with my kiddos and give my best self every hour I spend with them. And I don't think that I would be able to do that if I hadn't gone to Skyland. If I had to say one thing to someone living with a mental illness, I would say there's hope. There's therapists, psychiatrists, psychologists, people out there willing to help you, and Skyland was the hope for me.